We as Metro Mayors have heard our citizens' questions about coronavirus and worked together to assemble our community's public health experts to offer factual information on what is, how it can spread, and what we can do to prevent it. It's important to put things into perspective and to remain calm. We want everyone to know that our unified teams are preparing, not panicking, for the coronavirus. The river may separate our city's geographies, but it does not separate us from working together and our partners on this and many other issues. We have full trust and confidence in our public health experts' abilities to respond to this potential threat. We want to reassure residents of our public health teams are in constant contact with federal CDC and state agencies on this evolving health event. I would also like to acknowledge the group represented here today, which are helping us prepare for potential impacts in the community. We have our health system partners, Cass and Clay counties, public and private schools, institutions of the higher education, Hector International Airport Authority, and Fargo, Moorhead, West Fargo Chamber of Commerce. Now I'd like to introduce my friend, Moorhead Judd, Mayor Judd, to speak about his preparations as well.
Thank you, Mayor Mahoney. Also would like to take a moment to acknowledge our Minnesota partners of the City of Dilworth, Clay County Public Health, Moorhead Public Schools, Park Christian School, St. Joseph's, MSUM, Concordia, and M-State. Also send an acknowledgement to Commissioner Jenny Moja, who's here with us today, and I'll name a few others here in just a moment. These Metro partnerships are a vital link in our ability to respond to this or any potential threat to our community. Our healthcare facilities, our businesses, our public and private schools, our higher education institutions can help us with public education and prevention in order to minimize the impacts to our residents, our businesses, and our visitors. Public health officials are our leaders in our communities when we face a significant health event, and you'll hear from them in just a moment. Our emergency management staff from our counties and cities have a critical supporting role in ensuring a community framework for our public health officials to keep us safe. Clay County Public Health Administrator Kathy McKay is present here today, along with the City of Moorhead's Emergency Management Director and Assistant Fire Chief Chad Stanglin, and also Josh Eberts for a Clay County Preparedness Coordinator. Assistant Chief Stanglin works with the emergency managers from the other units of government to ensure that our whole metro area is in sync with our potential emergencies. More critical and major takeaway from today is that each of our respective cities are committed to a full continuity of governmental services for our residents and our visitors. We are communicating prevention messages with our employees, making contingency plans should the situation change, and we're consulting with our public health and emergency management officials about any changing conditions. It is not unlike how our communities come together and pull together for significant events that occur within our region. I will now turn it over to Mayor Dardis for his remarks on how others in the community can prepare.
Thank you, Mayor Judd. Thank you, Mayor Mahoney. The role that we have here today is to communicate to the public how very important it is that our cities jointly work together on this. Obviously, the lead is going to come from the healthcare professionals, the people of the North Dakota Health, Fargo, Cass Public Health, Clay Public Health. So what we're here to do today is to assure the public that these fine professional leaders in the healthcare industry are going to do what's ever necessary. We, as political elected officials, will support them in any and every way we can. I'm very pleased to see today that the Fargo, Moorhead, West Fargo Chamber of Commerce is here. Thank you, Jim Parsons, for being here. Because as part of this is, as this should possibly come about, we're going to call on the business community also. As a retired businessman in this community for 43 years, that's an integral part of dealing with our staff, the staffs of all of the people that work in the Fargo-Moorhead area on how to deal with this, to make sure that the business owners have the proper sanitation type things to make sure that their employees are washing their hands and using all the proper techniques that are available to us to do everything we can to shortstop this. So on behalf of again, as the elected leaders in this town, we're going to call on the business community to take a leadership role as well as working with them. Because keep in mind that if this does come to our community, there are going to be issues where possible suppliers are going to be shut down. So you're not going to be able to run your business like you were. Your staff might be greatly shortened and all those types of things. So from a business community perspective, the Chamber of Commerce, the Greater Fargo-Moorhead Economic Development, all of us that deal with that public sector, we will be lockstep in helping communicate the role of what the professionals in the health industry is and what they have to do. So we just, again, want to assure that all the business community that we stand beside them, and we're going to take their lead, we're going to take their advice, and we're going to do everything that we can possibly do to keep our community safe and avoid this. Thank you.
Hello, thank you, mayors. I am Dr. Heidi Lako Adamson. I am the health officer for both Cass and Clay County. And so I'm going to be talking about what is this coronavirus, or what is this COVID-19 we keep calling it. This coronavirus is a new or novel coronavirus, excuse me. And it's responsible, most coronaviruses are just responsible for mild cough and cold type symptoms, and we've all had them, but this coronavirus is a little bit different. It's more like the SARS and the MERS that we've seen in the past. So when we are looking at or reading anything online about this COVID-19, what do those letters mean? So the COVID is coronavirus, the D means disease, and the 19 is that was discovered in December of 2019, so that's why the 19. Yes, we're dealing with it in 2020, but that's when it was discovered. So this virus is believed to have come from bats, and it started in an open air market and with live animals in Wuhan, China. And now it's being transmitted human to human. And how is this virus being transmitted? Well, it's like any cold virus. It's through respiratory droplets. Either like me talking, I might be spraying some respiratory droplets towards you. Don't worry, I'm not sick with the coronavirus. So speaking to someone within 6 feet of yourself, or as we cough and sneeze and we don't cover those coughs and sneezes, it may land on solid surfaces, or in solid surfaces like keyboards and computers and your mice and those types of things. And even handshaking can transmit this coronavirus. So how does it get into our system? We touch the solid surface, or we've been in contact with someone that is infected with this coronavirus, and then you rub your eyes, you know, wipe your nose or something like that, and then that gets into your system. So that's how we can transmit this coronavirus. We don't know a lot about this coronavirus because it is quite new. It does spread very easily though, so just be prepared that when and if it does come to our community, it is pretty fast progressing. But just to remember that the CDC website is a good source of resource for checking on updates, because this is going so fast. I mean, last week we were hardly even talking about coronavirus, and now here we are with a press conference. So you need to check the CDC website for updates, and they do update every Monday, Wednesday, and Friday during the week. We want to create a community of preparedness and not panic. So, what are the symptoms of this COVID-19 that we keep talking about? Excuse me. We can have anything from no symptoms at all, and you just test positive for the COVID-19, or it could be mild cough and cold type symptoms, which is the most common symptoms that you may get. or there may be a severe shortness of breath and lower respiratory signs and symptoms such as pneumonia. So incubation period is around 2 to 10 days, but it can be up to 14 days, and that's where we're getting this 14 days of quarantine or self-isolating, those types of things, because it is a 14-day possible incubation. So who is impacted the most with this coronavirus? It's not generally the young, healthy population as SARS and MERS attacked in the past. So this is mainly elderly, and I define elderly as 80 and over. So not 40, 50, or 60, come on. And those with chronic diseases, such as diabetes, hypertension, heart disease, chronic lung disease, and cancer. So those folks may want to take higher precautions than those of the general population. They may want to self-isolate themselves because they have a higher risk of death if they contract this coronavirus. So that being said, how do we treat mass gatherings? There's in everyone's mind, should we go to a concert? Should we go to Sandbag Central and fill sandbags March 10th? Well, you know, CDC is recommending business as usual. We don't have COVID-19 in our community that we know of right now. So you certainly can go to Sandbag Central, you can go to the Sportsman Show, those types of things. But you want to make sure that if you yourself are sick with respiratory symptoms and you've been in contact with someone that might have COVID-19 or came from an endemic area with COVID-19 like China, Italy, Japan, those types of things. So then you should probably stay home. And it's a good idea to stay home if you've got respiratory symptoms anyway, because you don't want to give the flu or another type of coronavirus to someone that's sandbagging next to you. So, and just remember for current recommendations, such as travel and destinations, where you should and shouldn't go, please look at the CDC website, because it is an ever-evolving kind of information. So, and traveling on airplanes is fairly safe, so I will say that. They have constant air circulation, so you probably won't get it on an airport, it's just, or airplane. It's mostly the destination that you are going to, if that has significant infection in the community. So, and you yourself can always decide if you have one of those chronic diseases or you're just not comfortable traveling or going to that mass gathering, you can just isolate yourself and not go to as well. Thank you.
Hello. My name is Brenton Eastmeyer, and I'm an epidemiologist with the North Dakota Department of Health. And I'm going to talk a little bit about monitoring and self-isolation and what that means. So initially, when this coronavirus or COVID-19 came about, we talked about China and persons traveling from China, specifically the Hubei province where Wuhan is, and then the other parts of China as a whole. We worked with our federal counterparts in the CDC and got that travel information from those persons who had traveled back, whether they're going to visit family over the holidays, the Lunar New Year, spring break, or just a family vacation. And we got that travel information from the CDC, and we reached out to those individuals and asked them to monitor at home or stay home for 14 days from when they left China. That monitoring process looked like we contacted them, we got their symptom history, we asked for their temperature twice a day for that 14 days. And then everyone that we reached out to, at least on our side of the river in North Dakota, was very compliant, and we're still only monitoring 2 people, and they're about to drop off any day now from recent travel to China. But as Dr. Lako had alluded, this is an evolving process, and we've kind of moved on from that monitoring process, and with travel restrictions that were put into place, we aren't really seeing travelers from China, and now we're more concerned about the community spread within the United States and within our jurisdiction. So what does self-isolation mean? So self-isolation, it just means staying home from work, staying home from school, staying home from going to mass gatherings, the mall, the grocery store, anywhere where you may be around other people. Be prepared at home. So if you do have to self-isolate. Do you have access to 14 days of food? Do you have access to 14 days of water? I know that we're in town here, most of us live in town, and we will have access to clean water. Our water supply is never going to be in question, but if you live in a rural community where you rely on bottled water, making sure that you have enough bottled water for 14 days, making sure that your pets have food for 14 days if you don't have someone else to care for them, and just making sure that you have your prescription meds for up to 14 days. And if you don't have someone to do that, and you are in this isolation procedure, or we're asking you to quarantine for 14 days, public health is a great resource, or working with community partners and setting up that grocery delivery, seeing if there's a prescription delivery service available so that you can get that stuff for you at home. We want life to continue as normal, and we want you to have access to your basic needs. So reach out to those services, just making sure that you're setting that plan into place in case something were to happen, and we would ask you to isolate or quarantine yourself for 14 days. And then where can you go for credible sources? Dr. Lako had alluded to it, but the CDC is a great website. They have ever-evolving information. They're updating it as rapidly as they can with ever-changing information. And then Minnesota Department of Health and the North Dakota Department of Health both have their own respective coronavirus websites. You can link to them through their main pages and just find the current information for travelers, for isolation protocols, and what businesses, churches, schools, and even you can do in the community to protect yourself. So make sure that you're going to those reputable sources. And I think that is it. Thank you.
Good afternoon. I am Desi Fleming, the director at Fargo Cass Public Health, and I am just going to briefly talk a little bit about recommendations for prevention. And as Dr. Lako had mentioned, this COVID-19, this is a novel or new virus. So because of that, there is no vaccine at this time. They are working on developing a vaccine, but that is not going to help us in our current situation, right? Because that's going to take months to get that developed, tested, those types of things. But it may help us if this virus impacts again in subsequent years. So that would be the benefit of getting a vaccine for this. What we do know as far as the transmission is the virus seems to be transmitting the same way that most colds and flu do. So public health and CDC are recommending very similar prevention strategies. And a lot of these are really everyday actions that we can do and pretty easy to do. So the main one that we've all heard of course, is washing your hands, right? So we all know it, but are we really good at doing it? Probably not as good as we could be. So when you wash your hands, you want to make sure that you are washing with soap and water for a minimum of 20 seconds. So they say that that's equivalent to the length of 2 rounds through Happy Birthday, if you don't feel like counting, but just so you know that. You can also use hand sanitizers, but you want to use one that's got about a 60% alcohol content in it. But this really isn't a good replacement for soap and water. And if your hands are visibly soiled, of course, soap and water is the best practice. So cover your cough, cover your sneeze, preferably with a tissue, so that can be then discarded in the trash. But if you can't, there's the coughing into your sleeve, anything that you can kind of disrupt that droplet transmission. Stay home when you're sick, that's been brought up. And then don't go back to work until you're feeling well enough to return to work. Those are really important things, and we want employers to kind of be a little more empathetic going forward with those recommendations. Avoid close contact with people who appear sick. So most people who are ill visibly look like they probably are ill, right? They're coughing, sneezing, they may just look like they're really tired. So just steer clear of those people, just to be safe. Dr. Lako talked about avoiding touching your nose and mouth and eyes. Obviously, viruses can't get through intact skin, right? But we can have germs and things on our skin, and then if we touch our eyes or any mucous membranes, then we've kind of provided that avenue into our body. So try to avoid that. Disinfecting, wiping down things frequently, whether that's doorknobs, any household, you can use household cleaning products, anything, just do that more frequently than you're doing now. And then in general, getting plenty of rest. getting plenty of sleep, eating healthy foods, just kind of managing stress. I know these are really stressful times, but doing the best you can to manage that. All of those things help to boost our immune system, and we all know that having a healthy immune system will then help us better fight off infections and diseases. So one other thing that's been in the media often has been the issue of wearing face masks. So CDC does not recommend that well people go out and buy masks, okay? So the masks, you may see surgical masks that when you go to your health system, right? And they'll ask you symptoms like, do you have respiratory symptoms? That's what that is for. So the masks are for people who are experiencing symptoms, who are sick. They put those on so that they can reduce their infectiousness to other people. So don't go out and buy masks if you're well. The other type of mask, which is the respirator or N95 masks, those we need to reserve for healthcare providers, first responders that are actually responding to maybe situations where there is a contagious individual. Plus, you can't just buy an N95 mask and put it on and have it be effective. Those need to be fit tested, which means they need to check sizing, they need to check the seal in order for those to be effective. So bottom line is, if you're well, don't wear a mask, okay? And the actual take-home message of this is, so viruses need a live host to stay out there, to stay viable, right? So anything we can do to break that chain, to make sure that they don't continue, do these everyday preventions, is going to help protect you and everyone else around you. Thanks.
Any questions? You want to open up questions?
Nope.
Good afternoon. My name is Kathy McKay, and I work over at Clay County Public Health. And I will talk a bit about what is public health's responsibility, especially during infectious disease events like this. So public health plays a vital role in keeping our community members informed when it comes to infectious diseases or any other health risks to our population. We convene meetings, and we will have one later this week with our local healthcare providers. We share updates, information, and we identify any resource challenges that may be occurring now or in the future with this event. In conjunction with our state health departments and our partnering agencies, we develop our response plans and our proactive strategies for these types of events. Risk communication is core to public health. With any disease outbreak or any health emergency. So this means we want the information to be clear, credible, accurate, and consistent. And providing joint information, as we are today, is vitally important, especially in our metro area. Local public health works with our state health departments closely. We want to ensure that the public's health and safety are protected, and identifying and addressing our local needs. Now, for businesses and organizations, we encourage employers and employees to stay home, just as was mentioned prior, is stay home when you're sick. You protect other employees, but you also protect the larger workforce of that organization. One sick employee can really affect productivity, but an entire team is a much larger problem for productivity. So we say stay home when you're sick. That's a pretty easy message. It's stop the spread, but it's sometimes difficult as employees don't always have sick leave that they can take. They're concerned about that, and they're also feeling compelled to just come to work and tough it out. I'm not that sick. So that can be challenging in our businesses. We do encourage businesses and organizations to look at your sick leave policies and review that with the HR departments. We also recommend that businesses and organizations identify your critical functions and develop plans to how you may provide those functions if you have increased absences with employees. We have challenging times ahead potentially, and if we all work together and everyone does their part, with the planning, preparing, and responding to this emergency or emerging public health threat. We hope that that will significantly reduce the negative impacts in our communities. The Minnesota Department of Health has a hotline number, both for the medical providers and for the public, and that is on the website, and it's in regards to COVID-19. So they are available to take those calls for information. And I don't think North Dakota has does the North Dakota Department of Health have a hotline at all? They do not, okay. Not yet, okay. So I think that's it. We appreciate all of you coming today, your time and attention to this matter. Special thanks to the mayors, our city and county officials, healthcare systems that we work with. So we are all working together in this effort to address this outbreak.